We have a little change in our schedule. Now we have Dr. Laura Lee Hall, and she's going to speak to us on the importance of vaccination for people with diabetes. I'm just going to give you a little bit of her resume, just a little overview. She is the president, Center for Sustainable Healthcare Quality and Equity, a part of the National Minority Quality Forum. Dr. Hall is the president of the Center for Sustainable Healthcare Quality and Equity, a part of the National Minority Quality Forum. She is dedicated to translating big data into usable information to promote health equity. So what I'm going to do is I'm going to let her tell you all about it. Let's give her a round of applause as she comes forward. I'm going to leave it here.
I guess I'm a glutton for punishment following these two gentlemen. Reverend John, thank you so much. We're really proud to be able to support all of you in the most important ministry that you're doing. I apologize for asking to be moved ahead in the schedule. My husband, the Reverend John Price, and I need to get on a train back to DC for him to do his morning church business. So forgive us for leaving a little early today. I think my most important message is to thank all of you involved in the churches in your community and promoting health and well-being. I mean, to someone's ears like mine, this message of don't take your medicine, it's shocking, right? It's a shocking thing to hear. But really, this message of people taking care of their own health is so understated. And you have a big voice to help people in your communities take those hard steps to earning and nurturing their health. Thank you so much, and I thank you for the privilege of talking here today. So I work for, actually, Dr. Gary Puckrin, founder and CEO of an organization called the National Minority Quality Forum. It was founded in 1998, and it's really the nation's, I'd say, biggest and most important advocacy organization for minority health. And he's been collecting data and translating that data into maps and advocacy and education for 20 years. He asked me to join him a few years ago in starting SHC, a new center within NMQF, to really put a sharper focus on reaching out to the communities and taking that data and training community clinicians, community leaders like yourself, so that you can own the health of your community. These are just some pictures to show NMQF is deeply involved in advocacy. Just last year, Vice President Biden spoke at our annual event. I wish every one of you, I'm going to show you my email, would email me and we could get you invited to this forum. It's a national meeting of leaders like yourself. So you get to learn things, you get to connect to folks. That wonderful picture on the right-hand side, let me see if I can use the laser here. Not so sure. That's our 40 under 40. So every year we honor 40 under 40 people of color who are becoming leaders in our community around the country. I wanted to show you this. One area we work on that I'm not going to talk about is cancer. And we heard some discussion about cancer already. It is true that for many cancers, people of color get the disease earlier, get a more virulent form of the disease, and or do not get screening in a timely fashion or treatment, and thus succumb. It's a huge issue, and we're working on a number of cancer initiatives to help people in the community, again, promote early screening. We have maps, and I would like each and every one of you to go. I'll show you what they look like to the maps that will show you health information about your zip code, so you could really understand your needs and your population. It's our hope that this isn't just data for academics, and we love working and partnering with our SUNY Downstate academics, Amy and Elizabeth, Tanya as well, at Arthur Ashe. But this is really for you all to understand your community's health needs. And you see, we work with lots of folks around the country to bring a message of health promotion. So I'm here to talk to you about vaccines, which I think has become a dirty word in the last several years. And I never dreamed in my life, I'm a neuroscientist by training, that I would be out proselytizing about the influenza vaccination. But this is a kind of an easy one for me. Even with vaccines that are not 100% effective, flu vaccines, there is much life that is saved. In this year, 2017 to 2018, 50 million Americans got the flu. Nearly 100,000 went to the hospital. And nearly 80,000 people died that year. Of those, with only 40% of the population getting the vaccine that was only 40% effective, you see the numbers of lives that were saved and illness averted. Last year was a little bit of a lighter flu year than the year before. Nonetheless, probably about 49,000 people died last year in the United States from the flu. That's that last box there. I'm trying to convey to you that the flu is a very serious illness. So I looked at this, I'm a little bit behind, and that we've got 2% of all doctor's visits this year were related to flu-like symptoms. It's early in the flu season. I leave you with this URL to go on the internet, and you can keep track of the flu and how it's for affecting your community. I was lucky enough to work with some of the not just best minds in research, but also clinicians and healthcare providers and community leaders to look at the flu and its impact on older people in the United States. What all the data showed, and there was a gasp of aha, us in our little siloed academic circles didn't quite put the pieces together. But older adults are extremely vulnerable to the flu. And it is not uncommon that a bout of the flu for those 65 and older to begin that slippery slope to the loss of independent living. People didn't quite put that together in this room, and most folks don't realize that risk. The other thing that I don't think many in our system, in our communities understand is that while our immune systems get a little less vibrant as we get older, there are newer vaccines that actually address that. So you get older, your immune system's less strong, but there are newer vaccines that can help fight the flu. The gaps in terms of flu vaccination vis-a-vis racial and ethnic disparities are jaw-dropping, and I'll show you that. And we kind of resolved that we just didn't want to write another paper and go on to our next advisory group meeting, but that we needed to make some change, and I'll show you why. So this is flu vaccination rates that the government reports since 2010. So that line looks almost like it hasn't improved at all, right? Think of all the money spent and all the time on flu vaccine development and communications and education. Under 50% of the population gets a flu shot. Even went down. This last year went up a little bit because the previous year had so many deaths. Even our most wise older adults over 65 are not wowing us with the rate of flu vaccination. Only 60%. This is from survey data from the federal government. Not improving. I mean, this is kind of urgent. We should stop spending the money if this is the result we're getting. So here's the federal government's estimation of disparities. And I'm sorry I'm not making this, oh, here we go, just in time. So it's a little bit complicated, but you see they estimate that whites have a 40% influenza vaccination rate. You see blacks, it's 8 percentage points less. That's a big difference in these kinds of data. Hispanic, even less. Asian Americans, or living in America, are really similar to white population. These are big disparities, almost unseen at this level in other disease categories. I kind of get angry. This is our data. This is Medicare fee-for-service. Okay, so no one should even have to spend a penny to get a flu shot in Medicare fee-for-service. And here you see, for the white population, about 50% of the 65-year-old plus in Medicare fee-for-service had a flu shot. Look at the black population, 32%. That's whopping. Look at the Hispanic population. I guess the novel thing in this study that we've reported is that HD stands for high dose. It's one of the vaccines that has been shown to be more effective in older adults. And while whites are more likely to get it than the standard vaccine, if you are non-white, you are much less likely to get the high dose. So some big disparities in terms of vaccination. Here's one of our maps that really shows you the distribution of vaccination rates across the country, with the bright red being the zip codes that it's highest. And I think you immediately see there's broad regional variation. Here's the black population. So we all know that most blacks live in about, I think it's 3,000 zip codes. What I probably didn't point out for you all is that while in whites, the highest rate is like 75%, in blacks, it's 25%. So this looks red, but it's not red. This is all yellow. Here you guys are. Not a good number compared to the nation. And this is among blacks. So, not a good number, even compared to blacks across the nation. So I've suggested to you that flu is actually more dangerous to people over 65. 95% of the deaths are from flu or in people above 65. And also people with various chronic conditions, many of which maybe would be reversed with some good diet, but nonetheless, it's a serious risk to these populations. And I just wanted to show you a little bit of impact, because this is another thing we found was not well known, even among the medical community, that after you get a flu, and so each of these kind of infographics represents a published piece of research, that if people who got the flu were shown to have a 6 to 10 times higher rate of heart attacks shortly thereafter, and an 8 times higher rate of stroke. The flu is a serious business, especially if you're older. So this is kind of the preventive effect of various approaches for heart disease. And you see, you stop smoking, that's a really good thing to do. Take your statins or your high blood pressure medicine, that's a good thing to do to avoid a heart attack. But look, get a flu vaccine, it's in the ballpark in preventing a heart attack. So this is a study that estimated the benefits of a flu shot among people with diabetes, kind of the reduction that you see in these various outcomes: stroke, death, heart failure, heart attack, pneumonia. Like, who knew? I do a lot of work around the country with practices serving communities like yours. I'm in fact working up in Queens doing a big program. And the important thing I'm learning from that work is not only that the doctors are important, they have to make this a priority and have their staff promote getting a flu shot, but it's actually the medical assistants and nurses and LPNs in those practices who are a voice that's trusted by the patient that can really put forward how important getting a flu shot is, what an easy dose of prevention a flu shot is. And I would simply say to you that you are an extension of that your voice, literature you hand out, education you provide to people in your community can help folks understand that the flu shot is not going to give you the flu. The flu shot doesn't work. I've never had the flu, so I don't need the flu shot. A variation. These are common objections given that you can respectfully communicate to the people you have influence over, people who trust you and your word. So that's really the reason I wanted to come up and talk to you all today, even though it's about diabetes, is I know that your voice is really important. There's so much room for helping folks in your community improve their health through this simple preventive measure. And this is the website for our map where you can get resources. That's my email address. Email me. I have some posters that will be available to you, so email me. And I'm glad to answer any questions now or via email. I should say how many people got their flu shot. So look at this, that's good. Yes, ma'am?
Thank you so much for your presentation. I like the fact that I can have access to statistics and maps and so on, so I'll be checking it out.
Thank you.
My question is around, is the flu shot the only preventative prevention for the flu? Because I know for a fact that it causes, especially older adults, some serious debilitating results. Just recently, I know of one woman who had the flu shot and she fell, she was unable to walk, and since then she's been walking where she walked, with some debilitation now. She needs to have a walker to walk. But I'm saying that to say that, it's just like what we're hearing today. I don't take the flu shot. I remember myself taking the flu shot some years ago. And I worked in a hospital, and I sat in that chair, and the woman who was about to give me the flu shot said to me, well, there's some mercury in this medication. And it's like, what on earth? And I'm sitting there, and I basically had no choice because I was already primed to take this. But since then, I've never had another flu shot. But what I'm saying is, diet is also something. What I do is that I take vitamin C supplements, and I take, I just eat a lot of, I eat a lot of fruits and vegetables. So, your presentation sounded more like the flu shot was the only preventative thing that we can do to not get the flu, which I think is somehow misleading, or that it was The only thing that those populations were more likely to do to prevent the flu as opposed to the minority populations. I hope I'm... Yeah, that's the question. The question is...
I thank you for that question, actually, on a number of fronts. And people are probably saying, you thanking for that question, huh? First of all, I'm not a clinician and I'm not going to pretend to know all the clinical literature and practice. There's some folks in the room who may be able to better address that. The CDC's own site says hand washing and covering your mouth with your arm are preventive measures. To my understanding, a flu shot is the best way to prevent the flu. It does not have mercury in it. Vaccines used to have mercury in them. They no longer do. They can cause a reaction, especially if you get the high dose. You get a tenderness in your arm often. You can get a little low-grade fever. You can feel a little bit sick because your immune system has been stimulated. But I don't want to be a poser as a clinician, and I'd invite other clinicians to hearken in. But the reason I'm really glad you raised that, there's a lot of people who are afraid or have concerns about about vaccines in general. And in an era of uncivil dialogue, it seems in every sector of our society, I think it's really important for us to have conversations about things like this in a way that is honoring different viewpoints and sustains a good relationship so we learn together. So that's my best answer to you, ma'am, as far as my knowledge is. So the high-dose flu vaccine is a particular type of vaccine that I can't give you the biochemical background for it. There are several different kinds of flu vaccines. And what I will refer you to is the CDC's website, which lists all the vaccines available. Most people are getting the quadrivalent this year, and older people are mostly getting the high dose. I thought I saw someone over here. Okay, it looks like my time is up and I'm getting the old cane.
Thank you so very much. Let's give her a round of applause. That was valuable information, especially when you consider being a diabetic. If you know a person who is a diabetic, they tend to get sick more often. So encourage them to do everything that they can to keep from getting the flu. So we thank you so very much. Laurel, we thank you for coming here, and we thank you for taking the time to be with us here in Central Brooklyn today.